Hello, my name is Michael Garza. Here's my ID. Today I'll be doing the intravenous fluid medication administration video. Today our patient is going to be receiving 150 milliliters of fluid over 1 hour, which is 60 minutes. The drop factor is 15 drops per 1 milliliter. Math converts to 37.5. We can't have half a drop, so it turns to 38 drops in 1 minute. I'm not sure if you could see that. And then for our medication, it's gonna be amoxicillin. Drop factor is the same, 15 drops in 1 milliliter. The amount we're giving is 250 milliliters. Oh, bad phone was dying, sorry. 250 milliliters over 15 minutes. Converts to this, and the final answer was 250 drops in 1 minute. So when we're going into the patient's room, we want to do 2 identifiers, name and date of birth, wristband usually. We want to verify the patient's 6 rights, patient, medication, dose, route, time, documentation. And at this time, we want to ask the allergies. If they do report any allergies, we'll refer back to the chart and verify them. Wash our hands, put on gloves. And then at this point, I'm going to walk through the parts of the tubing. They're both 15 and 15. So the part of the primary tubing is the spike portion. We want to make sure this stays covered and sterile at all times until you're putting it in the bag. This is the drip chamber. When we're ready to, after we insert it, we want to make sure this gets half full with fluid. This is how we verify how much medication is coming down. We count the drops physically. After that, you have your clamp. Your clamp is how you adjust the rate, whether you want to slow it down all the way or somewhere in the middle. Here is your port. This is how we do piggybacks, administer other medications to connect to this. And then at the end, we have the part that connects to the IV site. Out for now. And then our secondary set is very similar. Spike chamber, make sure that stays covered and sterile. Drip chamber, I call it spike chamber, it's just a spike, sorry. Drip chamber, tubing, and then clamp again, and port that connects to the white port. Our 2 fluids are right here. So when administering, you want to get the primary set. Make sure you verify that it's with the provider's orders and make sure everything is right. Usually you want to take off this part first to the bag. Make sure this is clamped all the way down. And then take off the spike and go ahead and spike your bag. Make sure this goes all the way in. Okay, once that's in, make sure you have a trash can or something for the tubing to pour into. Hang it. And then once you're ready, you don't want to open it up all the way. I have mine a little tangled right now, so I'm going to untangle it. Once you're ready, have a trash can available. You want to get this halfway and then unclamp the end. This is going to pour out, so you don't want to do it you don't want to release the clamp real fast. You want to do it kind of slowly, and you want to prime your line. Wait for a couple of drops to come out. You want to make sure there's no air bubbles in the line at all. And once it's primed, you can go ahead and clamp it again. Once clamped, we are now going to verify the right amount of drops coming per minute. So for the fluid, it needs to be 38 drops. So I'll keep this over here. Just my watch. Keep this over the trash can, and we're going to count 38 drops in 1 minute. And this is how we have the right rate of medication going into the patient's IV site. Adjust as needed. Make sure you count for a full minute. And if it needs to change, you can go ahead and change it with the clamp. So this rate we're looking for right now is 38. It looks about right. Okay. And once that's ready, I'm going to turn it off. Once it's set to the right rate, that's when you connect it to the patient. And then once completed, you want to cap it off. And now we're going to connect the secondary medication. Let me stop here. Not to spill anymore. Secondary medication to be identified with the orange label. One thing I didn't say earlier is this needs to be at least 30 inches above the IV site, and the medication, if you needs to hang higher than the fluid. So we're gonna do the same thing. We're gonna spike this bag, remove the end of that, remove the end of your spike. Make sure your spike is capped off, is turned off, and then we're gonna spike the bag. Once again, make sure this is all the way in there without touching the spike, because if you touch a spike, that's not very sterile. Once you do that, hang it higher than your fluid, and then this is going to connect to our Y port. Take that cap off. Before connecting it to the Y port, we want to make sure we clean it with the alcohol swab. After cleaning that, let that dry. Let it dry. After it dries, connect to the port with a secondary line. At this point, you can remove the edge. Don't release the clamp yet until this is halfway. Once that's halfway, we want to prime it again. This secondary line has not been primed yet, so we want to remove it the same way we did with the first line. Make sure all those air bubbles come out. Okay, that's primed now. And now that that's primed, we're going to verify the medication right here. We're going to count. So the amount we needed is 250 drops per minute. So we're going to count 1 minute again. Get it as close. Not as close. We're going to get it to 250 drops per minute. And once again, verify for 1 minute, count as much as you need to. Once set to the right rate, you would connect this part to the patient. Make sure you turn this off so that way no fluid comes out. Connect it to the patient. Set it back to the rate it's supposed to be at. Make sure you turn on both the fluid and the medication as needed. So the fluid will be at 38 drops per minute. The medication at 250 drops per minute. At this point, I want to make sure the patient is comfortable. Check the IV site. Make sure it's appropriate. After that, remove my gloves, clean up my trash, and wash my hands before leaving the room. Thank you.